Next topic is thiazolidones. So let's see what is the mechanism of action of thiazolidones. So these are the selective agonists to the nuclear receptor, that is peroxisome proliferation activator receptor. So which is mainly found in the adipose tissue, heart, liver, and skeletal muscles. So they bind to these receptors and it will increase the transcription of the genes, and which is essential for the insulin sensitivity and carbohydrate and lipid metabolism. So it will increase the uptake of glucose and fatty acid, and it will differentiation and proliferation of the adipocytes and enhance the lipogenesis. So pharmacokinetics, it is completely absorbed and it is the oral route of administration, and it is metabolized in the liver and excreted in the urine. But this drug has been only administration daily once. So pharmacokinetics, it is the oral route of administration and it is metabolized in the liver and it is excreted through the urine. Adverse drug reactions are weight gain and heart problems, headache, anemic conditions, and fluid retention and plasma volume expansion. So therapeutic uses, it is used in the treatment of the type 2 diabetes, and it may be used alone or it may be used in the combination with other diabetic drugs. So its main function is to reduce the high blood sugar levels in the body. Next, rosiglitazone. So next drug is rosiglitazone, and this is the structure, and if you see the IUPAC name 5,4,2-methyl pyridine 2-YL amino ethoxyphenyl methyl 1,3 thiazolidine 2-dione. See here 5,4,2-methyl pyridine 2-YL amino ethoxyphenyl methyl 1,3 thiazolidine 2,4-dione. So if you see the structure here, this is the pyridine structure, and here 2 carbon atoms are there, ethyl, and this is the amino, and methyl group is here, and here it is the ethoxy, and here phenyl group, and here one of the methyl, and this is the structure of thiazolidine. Here thia means sulfur, aza means nitrogen, and 2 oxygen groups are there in second and the fourth position. See here 5, 4, 2, here methyl, pyridine 2-YL means second position of the pyridine is attached, here amino, 2 carbon atoms with 1 oxygen atom is ethoxy, this is phenyl, methyl, 1,3 thiazolidine. Here thia in first position sulfur group is there, in third position nitrogen, in second, fourth position 2 oxygen groups are there. So it is dione. See here 5, 4, 2, methyl, pyridine 2-YL amino ethoxyphenyl methyl 1,3 thiazolidine 2,4-dione. And properties are colorless, it is crystalline in nature, and it is soluble in the organic solvents and insoluble in the water. Organic solvents like ethanol, dimethyl formamide, and DMSO. And pharmacokinetics, it is the oral route of administration, and it is metabolized in the liver to inactive metabolites, that is N demethylation, hydroxylation, conjugation with sulfate and glucuronic acid. And also it is metabolized by using the cytochrome enzyme, and it is eliminated through the urine and also through the fecus. So it is oral and intravenous route of administration, and it is metabolized in the liver by using the cytochrome enzyme and also some of the metabolites like demethylation, hydroxylation and conjugation, and it is eliminated through the urine and fecus. Adverse drug reactions: headache, cough, cold symptoms, back pain, low blood sugar, respiratory infections, irregular heartbeat, bone fracture, dark urine, yellowness of the skin or the eyes, nausea, vomiting, stomach pain, abdominal pain, vision problems, etc. Next, uses: it is mainly used in the treatment of the type 2 diabetes, means it is used to reduce the blood sugar level in the body. Next, pioglitazone. Next drug is pioglitazone, and this is the structure. If you see the IUPAC name, 5 4 2 5 ethyl pyridine 2YL ethoxyphenyl methyl 1 comma 3 thiazolidine 2 comma 4 dione. See here, 5 4 2 5 ethyl pyridine 2YL ethoxyphenyl methyl 1 comma 3 thiazolidine 2 comma 4 dione. So this is the structure of the pyridine. See here, one member for 6-member ring with one nitrogen, and in the fifth position ethyl group 1 2 2 carbon atoms means ethyl, here 1 2 ethoxy, and this is the phenyl, and here methyl. This is thiazolidine structure. Thia means sulfur, aza means nitrogen, so it is thiazolidine with two oxygen atoms. See here, 5 4 2, and here 5 ethyl pyridine 2YL ethoxyphenyl methyl 1 comma 3 thiazolidine 2 comma 4 dione. See here, 5 4, and here 2 5 ethyl pyridine 2YL ethoxy phenyl methyl and 1 comma 3 thiazolidine 2 comma 4 dione. And properties are colorless, needles from dimethyl formamide, water, and it is soluble in the ethanol, propylene glycol. And pharmacokinetics: it is a oral route of administration, and it is metabolized by both hydroxylation and oxidation. So these metabolites are converted to the sulfide and glucuronide conjugates. And pharmacologically, it is active metabolites, or these two are the active metabolites, are mainly found in the human serum, and it will circulate concentration or equal or greater than those of the parent drug. It undergoes the metabolism by using the cytochrome enzymes, and it is orally administered drug is recovered in the urine, and most of the drug is eliminated in the unchanged form in bile or in the fecus. So adverse drug reactions are swelling when it is combined with the sulfonylurea or the insulin, and low blood sugar, upper respiratory tract infections, headache, sinus, heart failure, and sore throat, muscle pain, fracture of the bone, and also the increased cholesterol level in the body, and decreasing of the hemoglobin and bladder cancer. Uses: it is mainly used for the treatment of the type 2 diabetes to reduce the high glucose level in the blood, and with proper diet and the exercise. So it is used to lower the blood sugar level in the body. So next, alpha glucosidase inhibitor. First drug is acarbose. If you see, this is the structure. IUPAC name is 5 3 comma 4 dihydroxy 6 methyl 4 5 6 trihydroxy 3 hydroxy methyl cyclohexane amino oxane oxy 3 comma 4 dihydroxy 6 hydroxyethyl oxane oxane 6 hydroxymethyl oxane 2 3 4 triol. See here 5 5 3 comma 4 dihydroxy 6 methyl 5 4 5 6 trihydroxy 3 hydroxymethyl cyclohexane amino oxane oxy 3 comma 4 dihydroxy 6 hydroxyethyl oxane oxy 6 hydroxymethyl oxane 2 3 4 triol. So if you see here 5 5 3 comma 4 dihydroxy 6 methyl here 5 4 comma 5 comma 6 4 5 6 trihydroxy 3 hydroxymethyl cyclohexane amino here oxane 2yl oxy 3 comma 4 3 comma 4 dihydroxy 6 hydroxy ethyl and oxane 2yl and here oxy 6th position hydroxymethyl oxane 2 3 and 4 triol. See here structure 5 5 3 comma 4 dihydroxy here dihydroxy 6 methyl and here 5 4 5 6 trihydroxy 3 hydroxymethyl cyclohexane. This is the cyclohexane and here oxane 2yl and here 3 comma 4 dihydroxy 6 hydroxyethyl. This is the structure of the oxane and here oxy 6 hydroxymethyl oxane 2 comma 3 comma 4 triol. So this is the structure and IUPAC name. Properties are white or off-white amorphous powder and it is soluble in organic solvents and insoluble in water. Next, pharmacokinetics. It is the oral route of administration and metabolized with the gastrointestinal tract by bacteria and also some of the enzymes. And 4-methyl pyrogallol derivatives such as sulfate, methyl, glucuronide conjugates are the other metabolites. So one metabolite also have the alpha glucosidase inhibitory activity. So it that is observed as the intact drug most completely excreted by the kidney. So the fraction of the metabolites was observed and excreted in the urine and the active metabolites is excreted into the urine and accounts for the less than 2% of the total administration drug. So when the drug is taken through the oral route, this is the process. When the drug is taken through the intravenous route, it is excreted in the urine as the active form, that is 89%. When it is orally, it is less than 2% of the oral dose was recovered into the urine. Adverse drug reactions are diarrhea, stomach upset, and stomach pain in the first few weeks of the treatment, and tiredness, vomiting, nausea, abdominal pain or stomach pain, rectal bleeding, and yellowness of the skin and dark urine. So uses, it is mainly used in the treatment of the type 2 diabetes, and this drug is mainly given with the proper diet and the exercise used to reduce the high blood sugar levels, to prevent kidney problems, blindness, nerve problems, loss of limbs and sexual problems. And it is also proper control of the diabetes may be risk the heart stroke and heart attacks, and also to slow the breakdown and absorption of the carbohydrates from the food. Next, Voglibos. This is the structure of the Voglibos. So IUPAC name 5, 1, 3 dihydroxypropane, 2YL amino 1 hydroxymethyl cyclohexane 1 2 3 4 tetrol. See here 5, 1, 3 dihydroxypropane 2YL amino 1 hydroxymethyl cyclohexane 1 2 3 4 tetrol. See here structure. This is the hexane 6-membered ring, and here in first position one of the hydroxyl group is there, and here methoxy group, and here in second, third, fourth position hydroxyl group 1 2 3 4. In 4 positions hydroxyl groups are there, and here amino 1 2 3. 3 carbon atoms means propane. In first and third position hydroxyl groups are there. See here 5 1 3 dihydroxypropane amino 1 hydroxymethyl 1 2 3 4 tetrol. See here 5 1 3 hydroxypropane amino 1 hydroxymethyl 1 2 3 4 tetrol. So this is a structure and IUPAC name. Properties, it is a white to half white crystalline powder, and it is soluble in organic solvents such as dimethylformamide DMSO. And pharmacokinetics, it is the poorly observed oral route of administration. So systemic adverse drug effect has been observed, and it is metabolized in the liver is negligible, and it is eliminated through the urine. The renal excretion is also negligible, and plasma concentration of the oral dose has been undetectable. So it has the poor oral route of administration, but if we take through the systemic means it has adverse drug effects, and metabolism and excretion is negligible. Skin rash, adverse drug reactions are skin rashes, abdominal pain, diarrhea, headache, nausea, constipation, and allergic reactions. Uses, it is mainly used in the treatment of the type 2 diabetes. It is given along with the diet and proper exercise to improve the blood sugar control in the patients, those who are suffering from the type 2 diabetes. So these are the references books should be followed for the anti-diabetic agents. Thank you.